move into right now. If you go to the top of the comments, we posted this. But this is the blog that me and Kathleen and Bart recently wrote about what we do and don't know so far from our scientific studies. So just to let you know, we took 35 people. One had to drop out for personal reasons, not anything medical. So we ended up with 34 women who stayed in the study, and it was 90 days. So if any of you guys are on here, just kind of check in and say hi to the group.
We have a couple of them.
Now. Yes, they were not public for 90 days, and they were not happy about it. But we didn't want them to be influenced because we wanted them to follow the protocols, because it is my job and our job as the research department to give you best practices. So these ladies were blasting. Go ahead and give a little bit of the protocols, not too deep, but just that they did heat. And
people might want to know where we got them.
Okay, I love that. Let's back it up.
Sometimes some people came from the FasciaBlaster's page. They were familiar with the product. We advertised the study on the page, and some of them came from outside advertisements and casting. So it was a variety. It wasn't all sold out Kool-Aid drinking Blaster sisters. It was a variety of people who.
Well, and also the Blaster sisters that did come in, we didn't let them blast for how long? Like we kind of wanted their fascia to.
They had to be a month of not blasting if they were allowed to be into the study. But most of them were not even blasting at all. Like most of them, I've seen it like on the page, and they're like afraid to kind of get into it. A lot of them were just curious about the product in general. Interesting. Which is very interesting, yeah.
And we had hundreds and hundreds of interested people, and then we narrowed it down.
Well, and also too, I think to Kathleen's point, people are interested in how does this even happen, and just so you guys know, you really can't run out even on the internet and just say, oh, this does this or this does that. Those are claims that you can't make. So I actually did a study with Testimonies International years ago with 5 people where we took people through the protocols to get the pictures and to be able to validate certain things into a controlled environment. So this study was just to take that original, like this is what we knew back then, and really go deeper. So we worked with the same company, which is Testimonies International, and she helped us to find the most amazing group of men and women at ASPI in Tampa. Bart, you can tell them a little bit about that, because when we showed up at ASPI, I was like, I don't know.
Yeah.
It's a lot of like really attractive young men, and
I like being there all day.
But it's terrible that I had that initial like they're way too hot to know what they're doing. But.
And there's all these like college kids and professional athletes, like they're training, and we're like, wow, we're just bringing like a cellulite tool, but as me and Ashley knew, like it was developed for athletes. So like we knew that eventually we would start using it on athletes and start using it on men. But this facility is great. They provide us with a lot of good resources, like not only in staff, but like they have a lot of testing supplies we can use, and it's just a great resource for us to use, and we're going to continue to use them hopefully in the future.
They are in the forefront of sports performance research.
Which, by the way, I think is better than even going like a traditional medical route, because they're not, the things that they measure are going from normal to fantastic usually, and I feel like that's kind of where we can apply what they do and reverse it out. Like I don't want to go looking for disease or testing for disease. I want to see the restoration process. So
and that's where it's moving. And I think to see them every time we do, there's excitement with the research department there and that facility to say this is a really amazing thing. I mean, we hadn't done a cellulite study before, but anyway, we can go into the study now, but I think it's cool. They see way past where we do, or with us, far into the future of what the potential is.
Yeah,
so
it's
that's
interesting
really
though, even with ASPI, so just so you know, they are third party. We took profits from the business to pay for it, but in no way are they paid, to skew anything.
No,
It was completely done in a totally scientific way. They have no skin in the game, so to speak. I know that's one of the things that I've faced on internet and in the press is people saying, oh, well, they paid for the study. Paying for it doesn't have anything to do with the findings. The findings.
Everybody pays for this. Like Pfizer pays for their studies. Like every commercial you see on a drug study, I mean, the first person to pay for it is the own company first. And then once you get the research out there, then schools and universities, students can start to look at it and make their own research and their own grants and stuff like that.
That's my whole soapbox about all this hating going on of the science and who's doing it and who's paying for it and what happens, because it's an evolution that every new product and every new theory goes through.
I mean,
so we're right on track.
Every drug that's ever been on the market usually has 10 to 15 years of research.
And by the way, I don't want to interrupt
you,
but we're talking about drugs. Those are the people who actually have the money to do the research. I would love to see how many exercise programs or plastic sticks or things that are as inexpensive as what we're selling. I don't think there is research about that. I can't find anything to even support the efficacy of the foam roller.
Foam roller has limited research. I mean, like, and it's
who
all
would study it? Who cares?
It's because there's no money. Like, there's no money in the foam roller. Like,
well, I wrote a whole answer to a question a couple of weeks ago about this idea that what makes you unique and Ashley Black Guru and the company unique is that we are putting the work into really an $89 piece of plastic. So you think about small money for this product, but giant implications and the faith in the product that you have. And you know, if I made a cake and I thought it was the best cake in the world, I'm not sure I would enter it in an international cake contest and say prove that it is or isn't, because I might not be, right? But that you took the money and that you put it out there, which opens you up for such scrutiny. And guess what? It's holding up. And I mean, that's just
Let me just say personally, I am more than happy to go on Good Morning America if you're out there, the Doctor Show, any of you guys that want to go head to head on the science, I'm ready to do it.
We can't wait to be on
we
those
can't
panel
wait to argue with you.
Yes.
So I do want to go into the findings. So again, if you are reading along, the blog we wrote in such a great way. There's things that we know and there's things that we don't know. But the things we don't know is because nobody knows them. I mean, this is stuff that's never even been, no one's even peeled back and looked at this. You know, these guys, even more so than me, they've been in the institution and, you know, in the medical trenches, and for you in the pro sports arena, you guys have never seen it. Like, there's very few fascia studies, and if there are fascia studies, they're not using the FasciaBlaster. They're looking at other techniques, and most of the techniques, like Barnes, are more at the surface. So I don't even think it's comparable research at this point.
Like, most of the stuff is like improving flexibility or like very limited recovery, and so nothing looking at blood work or like the actual science behind the healing process of stimulating the bruising and healing. Like, no, there's not a study that I've read that like is looking at blood work like pre and post treatment. So it's very interesting, and I think it's very thorough, and it gives us a lot of information about not only the safety of the product, but like also like what over time, what we can kind of look for and expect in the future. It's really interesting.
Let's talk about the two phases, though. There's two phases to this.
Yes.
Before you do the findings. The first phase looked at really the acute effects or the immediate effects of fascia blasting for these ladies. So you were talking about
tell them too why what we did do was we blasted the ladies ourselves. So they were just lying on the table because we didn't want that to be a factor.
Well, because blasting yourself is exercise.
No doubt.
So
I did it today, and I was like,
we looked at what happens when you receive a fascia blasting treatment, and the whole reason we did it passively was because we wanted to look at, you know, heart rate and respiratory rate and metabolism and blood work and all these things in it.
In all honesty, the reason I wanted to look in the blood was to figure out detox. So I know you guys want to talk about that, but I can tell you we don't have the answer from detox. But we do have some answers in what we did see in the blood and then what we didn't see the blood, which just leads us to the next. Okay, so what do we study next to figure this out? And we have some theories. And again, this is all stuff that you guys can read along with. But I think it was important that we did the blood. And by the way, we had the passive blast, and then we looked at the blood for 7 days. So that is the cycle that we were looking at, to see what happened in the blood with a single blast over a 7-day period.
Correct. And you called that your phases, kind of the phases of what happens after a blast. We called it phases of detox or phases of recovery or phases of the effects, and what happens at day 2, 3, 4. We took some people and we tested their blood and blood work at blood and all their other scans.
All of the other stuff. Yeah.
At 2, 3, 4, 5, you know, all those different days. We separated out so we could see do these changes happen immediately or how many days after? And that's a hard thing to see because we're talking to each other on the page saying, well, this happened immediately or this happened 3 days later.
Hashtag, poop farty hell.
Exactly.
Hashtag, I have 5 new zits.
Right.
I have the X amount of bruising. Is this normal? I screamed at my husband. I'm losing my mind.
We're trying to figure out all those
We're trying to
questions.
figure out what that is, because even though we didn't see that in the blood, that doesn't mean that it's not happening. It's just like, what we say with research, everybody wants to see it on paper and in numbers, but, there's 200,000 women, and if, a third or a half or a tenth or even 10 people to me are saying that they have that, that's something that needs to be evaluated further, and we want to give that, dignity, I guess. But what I'll tell you is that we don't have the answer for that. And what we know so far in the blood is that in terms of estrogen, which seems to be one of the biggest questions out there, we didn't see an increase with a single blast. We also didn't see any other notable toxicities in the blood.
Yeah,
Do you want? Kathleen's got the numbers. I see the little tiny research findings. You can go in more depth.
All I was saying is we did complete metabolic panel. So for people who want to know what we did complete metabolic panel. We also did supplementary testing, which included the testosterone, estrogen, progesterone, the thyroids, stimulating hormone, estradiol, triglycerides, C-reactive protein. Tell them about why we tested C-reactive protein.
That is an enzyme that's released when the body is experimenting inflammation process. So if the inflammation process... Experiencing the inflammation process.
I'm so happy to clarify.
So if it was going on, if there was an extreme amount of it, the marker would be really high, and we saw a very normal level.
Well, and to put that in really simple terms, what we're trying to make sure is that none of the body is, if it's too much on any system for FasciaBlasting to process, and it's not. So anybody who's worried about, we see it all the time. I see the questions about is this taxing the liver or whatever. What we know so far is the answer to that stuff is just no.
Your bodies and your organ systems are able to remetabolize whatever is being mobilized into the bloodstream. So we do believe with FasciaBlasting, we're mobilizing things into the bloodstream. We'll talk about that with regards to things. I say tings. Many tings go into the blood.
Exactly.
Many tings. But your body is able to remetabolize those and effectively and safely, and then rid them from your system. And we talk about this when we talk about these side effects, is all the systems that work together to do that. Your liver, your kidneys, your skin, your lymphatic system, and the whole thing has to work as a machine to take out this garbage that we're metabolizing. So none of the organ systems are taxed. Your body is able to do it. It can do it. And that's a neat thing. So that gave us the ability to
And by the way,
say,
we didn't pick overly fit people. And we also didn't pick young. It was a pretty big range. I don't know the exact. You designed it. You probably know.
So 25 to 50, but they had to be still regularly menstruating. So I think there were some questions on the blog or on the page. People didn't know that we picked people who were still regularly menstruating for the purpose of trying to get stable estrogen levels and progesterone hormone levels.
Yeah, I remember looking in the blood, and there was one lady that really spiked at one point, but it was unrelated.
Yeah, we're looking at pulling out some case studies on some individuals who maybe are outliers, and that takes a little more time. But in our clusters
that's part
of people,
of why we're saying this is what we know and this is what we don't know, because we're definitely still looking. In fact, we're already casting the men's study, so this is going to be ongoing. So,
so we're pulling out little pieces to see what that looks like. But the good thing is, this is what the research team says we are able to do now with this, and this comes from ASPI to say we are able to say this is safe and effective at doing what we claimed for it to do, which was about fat.
I'll let you go ahead. I think the biggest thing is based on pictures and tons of anecdotal evidence and really just guessing, we wanted to be able to show for sure that the FasciaBlaster could burn fat, and it does. Drum roll. It does. So you can show them that. I love that little graph. So what we were really, we saw fat go down overall, because we were looking at percentages of body fat, but the subcutaneous fat is what I found so interesting. So subcutaneous is like the first fat below your skin. I guess it's like your visible fat.
Mm-hmm.
So we can talk about this. That's the macro. So that's the, what does it look like and what's the thickness of it? Talk about that. And then I can talk about the blood. Yeah. Because the blood shows certain numbers, but then these ultrasounds show
I
others.
would love to go over these ultrasounds because I think this is fascinating. I just want to make sure I get the same person.
Yeah, they should be.
These are 30 days. Oh, do they have the 60? No, those are all 30. On the blog, if you guys are following along, let me tell you this, it doesn't take a rocket scientist to see the difference, but these are only 30 days. But the one that we showed within the blog, we have the 60 and 90 days. But if you are curious...
But it's really small. But
Oh, that's okay. I'll start with these because I just want to tell people what they are actually looking at. Hopefully the camera's picking this up. So this is the skin and the fascia right at the top, the structural fascia. And then this layer between the two white lines, which the two little white lines, just to make it really simple, are fascia lines, okay? So for those of you who have the book and are into it, you're looking at lines of structural fascia, and then all these other little white lines are the interstructural fascia. So in this, I'm sorry, I'm on a 20-second delay, so I can see it. You guys should be able to see, though, just in that image, that there's a lot of, trashy, kind of jacked up fascia well below the surface, even into the deeper layers, because this little circle down at the bottom is our femur. So this is like a whole thigh. And what we saw in all the cases was that these layers of fascia smoothed out, and it was even more dramatic than I thought it would be, and it was also a lot deeper than I thought it would be. Like, look at this one. You can clearly see, and these again are only 30 days. Look at all the white mangledness in the baseline picture versus the smoothness in the 30 days. And then I think another thing, if you're looking at the one online, is look how much better it gets after 30 days. It's almost like it gets a little better at 30, and then way better by 60, and then by 90. But I saw the biggest difference between 30 and 90. So those of you who are on your first 30 days...
I'm glad you said that because...
Okay, I'll let you take over.
Because a lot of the time during the study, right around day 30, I can't remember if you were at the day 30 or not, Kathleen, but a lot of the women were kind of discouraged. They didn't know if it was working. They didn't see the results directly, even though we could see them as clinicians that they were getting better. But kind of when I came back at day 60 to check on them, completely different. Like the results were much better. Like the day 30 to 60 mark is a huge mark. Like, so stay with it is one of, like, you have to stay with it through consistency because it really does change. I mean, these women experienced drastic results from 30 to 60. The bruising stopped. Like, there all sorts of great results they were getting occurred from after day 30. So stay with it.
So even Tilly's on here saying she's seeing great results now, and I think Tilly was one of the more difficult cases that we had in the study. So she's saying she's getting even better results at 90 days. And then I saw a comment flash up, is it 30 days consistently? Yes. Let me say this, you have to be dedicated to it. Don't expect that type of ultrasound esque result if you're doing 5 minutes in the shower on the one dent that you hate. We're talking about these women did between 30 minutes to an hour, and they did it with the cheap blow up saunas, and they did it 5 days a week. And then we backed a few people up to 4 days a week. But these are not people that are just barely blasting. If you want to completely restore your fascia, I think you have to be in the right headspace, you have to be ready to do it, and you have to be committed to it.
And what a lot of the women liked about being in the study was it gave them a reason to be consistent with fascia blasting. Like a lot of the reasons they didn't want it to stop is because they didn't trust that they'd be able to stay like consistent on their own. Like
they wanted a watchdog.
They're very dedicated. They pretty much wanted to do right by us. Like they really wanted to get us good results and so they did a
Jennifer
great
was
job of
what
doing
was that
that.
You did not pull. I saw. What if you're?
It said you didn't get all your fascia in one day, so you're not going to restore it in a
Thank
short
you.
time. It just had to do with
good comment.
Also, too, I do want to clarify. There's something that's being said that I'm kind of like that mom that's like, I don't want that in our family verbiage. I do not like hearing that I got rid of my fascia, okay, or that like I have more fascia or whatever. Just so you guys know, it's a 3-dimensional webbing system that is absolutely there for a reason. We've had lots of discussions about like the communication system this could possibly be, the fluid system. We haven't even gotten to that yet. But you want your fascia system to be completely intact. And that's what we're actually doing. So when we say break up fascia, we mean break up dysfunctions in the fascia, adhesions in the fascia, recoil. We're not breaking up fascia. I also saw, real quick, they had a question, did they do diet and exercise? No, they did not.
No changes to their diet and exercise.
So I hope that those Tampa subjects that are in, you guys that are watching, you guys go ahead and answer questions that are directed at you, because you know, and really I think you are the subgroup of fascia sisters who have really worked the hardest and the most dedicated in it. So
aside from Julie Chilberg.
Yeah. That's right. I know I was going to get some people saying, what about me? Yeah, you too. But anyway, tell them what you're doing.
Allison Rattay, who we met yesterday.
And how you're doing it, and how you've modified it, and how you what we did with bruising in between. You know, you avoided bruised areas, but continued to blast around and so forth. But so you talked about these visual effects of
well, we were
blasting.
talking about the fat, and I got sidetracked. So aside from the fascia restoring, which is very, very visible, and to me is just like, been telling y'all for years. That's the drop the mic, shut your face, here's the ultrasound image. But what I also found shocking was we measured the subcutaneous fat between the first layer of fascia and then down to that first layer of muscle tissue. Either one of you guys can speak on that, because I think, first of all, this is the first time in history that's ever happened that something besides diet, exercise, or some sort of surgical procedure has been able to basically break up subcutaneous fat. So I'll just...
So the researcher in me would say, well, how, Ashley, do you know you're really breaking down fat, or that you're lessening subcutaneous fat? Are we just squeezing it together so it's smaller, or is it really leaving the area? Mm-hmm. I wanted to show you how we know it's really leaving the area. Okay,
I'm so glad you asked.
Left the room. The fat has left the building.
It has left the building.
So after the initial blast, we looked at free fatty acids in the blood, and from the baseline, when they walk in the door, to after their fascia blast, the free fatty acids in the blood increased by 38%. That's huge.
So summarize that. We all know what that means.
Yes.
Okay. No, you can continue. You're doing well.
Will you?
Oh, Bart, we want to hear the man's voice. With man's groups coming up. Come on, jump in there.
No. So, like, I just want to say, like, people are like, free fatty acids, are they always floating in the blood? Like, no. Free fatty acids they bind to your fat cells, and they kind of like temporary homes for them. They either move in permanently or get circulated via metabolism, like they're burned, and then you use them. So these free fatty acids were just chilling on fat cells, and you stimulated them to get taken up or used. So that's why the increase is so drastic after professional blast.
But what usually makes that happen? Can I do it? What is it?
High intense exercise.
Exercise or food deprivation.
Exactly. So
two things that make the fatty acids, free fatty acids in the blood, increase that level.
And the only things
or food deprivation.
And if we show
and fascia blasting.
So I think do we have the graph of like at day 30, like. I don't know if we've shown this.
Well, I just remember from the study, the lead researcher, who, by the way, was like the researcher of the year, him being like, like, Houston, we have a problem? Is this a problem? Or am I, like, he thought that something had gone wrong because it's just so mind-blowing.
He said he retested, like, the
head shakes.
He's like, we paid our own dime to retest it to make sure, like, because it was just, you didn't expect to see such a drastic change.
So remember, they didn't exercise because they didn't do it to themselves.
Right.
They laid down on the table.
Exactly.
And the fatty acids leave, the free
like
fatty acids
40%.
leave the fat cells, go into the bloodstream, and then what happens? So we did this retesting after those certain number of days, and on day 7, it was down to baseline? No, even better. It was lower than baseline. So I'm just going, heart disease, what are we going to do?
Yeah.
Because
it's leading to so many more questions.
So let me finish this, though. So at day 7, it didn't just go back down to baseline about what kind of fatty acid levels are in your blood, but it went lower than baseline, and day 30 still
lower than
baseline.
So one professional blast lowers your free fatty acids that are circulating on your fat cells below baseline a week later.
Yep.
Which exercise would show
later.
that at like 2 days later. and then it would be back to normal. So even high intense exercise would not have that effect, which is very, very.
I can tell you, as soon as this study came out,
Lean forward.
the thing that I started doing differently was less cardio, because I was like, hey, if I am burning fat like that, I'm going to just blast.
Yeah,
My gosh, I'd much rather blast than do the elliptical.
So that goes perfectly then into metabolic rate.
Yes,
So the
let's go to
next
the next
finding
findings.
has to do with metabolic rate. Resting metabolic rate increased by an average of 93 kcals per day,
it's
which is 6% increase from baseline to after FasciaBlast. So after FasciaBlasting, they're burning more calories. Why? Better metabolism after
because
a
they're
FasciaBlast.
metabolizing more.
That's, ladies, if you're over the age of 25, that's a huge deal. I mean, it's not easy to bump your metabolism.
Right.
Yeah,
How do you bump your? You were saying
it's-
if FasciaBlasting, I'm doing less cardio because FasciaBlasting is a workout, but FasciaBlasting was a workout for these ladies just lying there.
It's
Yeah,
insane.
that's the point. Just taking a FasciaBlaster treatment is like doing a high intensity workout.
Everybody on this page
Metabolically.
is going to be like running out to get blasted instead of working.
So,
So something that keeps coming up, and I think that we can loop this into metabolic rate and what we're seeing in the ultrasound and the fat burning piece of this, is that there's this, again, one of those things that you hate to even float around the universe, because it really is a rare case. But when everybody is talking about this worse before better. So what I can tell you is that the ultrasound shows that you're better before better, regardless of what is happening at the
Visually,
surface
yep.
and visually. And I don't think that we need to give a lot of attention to a temporary visual result. It's so fun. It's almost distracting to see what y'all are. They're saying extra tips for Beyond Bounds. First of all, don't worry about lymph nodes. Just don't go crazy right where there's lymph nodes. You would have to really dig super deep to do anything that. And they're talking about extra tips for Beyond Bound. So that's what I want to talk about. So anybody who is beyond bound, that their tissue is impinchable. Like, see, my skin comes right up. And I think you guys know, like, what we say is more than an inch. And I have been working on my arm. Maybe a few weeks ago, I did a feed, and I was talking about how my arms might go through a worse before better. But what happens in beyond bound situations is where it's all bound together and you start to break it up, it'll break into smaller chunks. And if you actually have muscle mass underneath, like your muscle's not strangled out like beef jerky, then you don't even see the smaller chunks. It's only when the beyond bound gets kind of mixed with a lack of muscle tone, and then so it's a little bit looser in terms of the skin tonicity, not the actual skin, but the look of the skin tonicity.
Right.
So the answer every single time is to fire the muscles.
Yes.
Yep. So we're calling it the restorative process.
The
rather
restorative
than-
process
it's the-
and the better before better.
Yep, it's the restorative process, and there are phases of it that you go through where you break down those chunks into smaller and smaller chunks.
I know
And,
for me, I would be excited if I saw that. So I think it's just a little bit of retraining our brains to go, you know how people start to get excited about the bruising now? You should be excited if you see something that was one big, huge, solid chunk and now it's like littler pieces, because that means that you're getting there.
So I was trying to make it teachable by saying you can break down adhesions, which allows your skin to move more, and your skin becomes looser because it's more mobile over your tissues, and or over time of FasciaBlasting, you are decreasing the thickness of that subcutaneous fat layer, which might also make your skin feel or appear loose. But we're all talking about, we want it to feel or appear loose
Yes.
so that we can pinch it. And then this allows my muscles to work freely
Yep.
and without restriction underneath. So
And then they'll
knowledge is
poof back
power.
up.
Yes, so strengthen your muscles, stay hydrated, and you'll fill that back up. So, I mean, they understand that, yeah, look, my skin is loose. Oh, no. But, hey, that's great because my arm muscles work beautifully. They're efficiently. They fire. And if I work
Absolutely.
them, you want to then see the tone underneath your skin. The lines you want to see eventually have to do with muscle tone. And that'll happen
So
all the time.
Kathleen, so about this are now better before better. We
Yeah.
know that the healing process
Yes,
is
I wanna talk
different
about that.
amongst all sorts of tissues. So like you break a bone takes longer to heal. So the tissue can, depending on its state, just might take longer to heal. We know that the healing process can be up to like 2 years. I mean, we're not going to say you take 2 years to get better, but over the course of the 90 days, I mean, you're going to go through the inflammation, healing, and maturation phases. So you're going to increase the quality of that tissue over the course of up to maybe 60 days.
Stop
So
right there. So did you say that fascia blasting causes inflammation?
it does cause inflammation,
does.
but it's a good thing. It's a good thing. You want it. I mean, when stuff gets stuck, I like to think arthritis is inflammation. It's
Yes.
stuck in acute inflammation, and now it's over the time it becomes chronic, and those chemicals from inflammation is the chronic inflammation is what causes arthritis. So if we can improve the quality of the tissue and the joint to be able to get rid of the inflammation, we can improve on arthritis, in my opinion.
Okay.
Well,
Be a
I
fascia
have
blaster.
it, and I
Yeah.
can speak to that from a personal
Like-
level.
What were you pointing at
100%.
over there?
I was pointing out because I said, don't worry about your lymph nodes. All of a sudden, there was a thread about lymph nodes are for real. So I just wanted to address what we mean.
Okay, address what you mean.
I
When you
mean,
say don't worry about them.
what I'm saying is it's first of all, we address this in our literature. If you just go to frequently asked questions, there's circles that show you where your lymph nodes are, and that you can, like right where lymph nodes are, you can blast at the surface level. Like literally, unless you're taking the FasciaBlaster and digging it into
safe,
your
guys.
lymph nodes,
There's
it
no
is safe.
need to dig
Yeah.
under here because there's nothing restorative really that I need
Yeah,
to do
yeah.
here. I might do
Yeah,
this
I don't know.
I'm like, what
Pit
kind of-
tit.
Really?
You don't have it. I've been working on mine, so.
What I'm saying is the tissues
me.
around it, the tissues around
Agreed.
it, the tissues around
Agreed.
it, but to dig in there,
don't need to,
there's no
yeah.
indication to do that.
Right.
So we don't advocate it anyway.
Yeah.
We don't advocate digging into anywhere
We've
where you're
never
going to
said,
have
like-
that.
We
There's
also,
no
too, there was
reason
a comment
to, so-
about the lymphatic cancer, and what I can tell you guys is you need to, we unless your doctor approves it, just say don't, while you're being treated for cancer, don't fascia blast, just because we don't know. When we talk about things being trapped, we don't know what those things are. But I can tell you that I'm very comfortable with someone who has completed treatment for the lymphatic system, in part based on this guy that, if you guys went to the New York book tour, you met Pops. He's the guy who's responsible for the manufacturing of the FasciaBlaster, and he had stage 4 lymphoma, and us doing treatment on him was what really, saved him from having an elephant arm.
So
he
it-
uses it every day.
Our fascia blasting exercises the lymphatic system,
Absolutely.
whether it is a normal, healthy lymphatic system or whether it is impaired because of the pressure, the stroking, and then just the release of the tings that come out of the tissues into the lymph system. It's being asked to work. If you don't use it, you will lose it.
right.
And so even an impaired system has potential to improve. I wanted to dispel some of the fear that comes with the word inflammation, because the inflammatory process, and when I was joking with you saying it
Wait,
causes,
a lady says that she has bound tissue in her armpit. We want to see a picture
so
of it.
I would say start picking it up and pulling it.
Yeah, pick it up and pull it and
Pull it,
blast in this
pull it,
direction and around this
pull
way
it,
versus
pull it.
like
No need
a
to
straight.
I
just-
can't think of why it would be adhered there.
No, you
really.
can. I
It's
mean, breast
unusual, but-
implants could be put in there. I can
Yeah.
tell you that somebody who's like a
From a
surfer
scar.
who does like a bunch of circumduction type. When I treated a lot of pro baseball players, they do have it. So I can
Really?
make a case. I can't make a beauty case so much for that, but for sports injuries and different things like that, maybe so.
Start pulling on it.
I'm saying for sure, treat it, pull on it, blast all around it, go for it. It's so weird what you guys get into.
Okay, so I was talking about
Try to predict.
inflammation.
Okay, inflammation. Let's go back.
Interrupter.
I have to
Maximus.
interrupt because these ladies are demanding answers.
So I was talking about the fear that comes with the word inflammation.
Yes.
Right, and then I lost it. But I think I was going to say that the natural process of your body sending cells to clean up trash and junk and remove it from your system is what inflammation is.
That's all it
so
is.
the activation
taking
of
out the trash.
white blood cells to send and lymphatic system and activating all that to take out the trash is all it is. So we are
wants it, it needs
causing
it sometimes.
acute inflammation which means your body's remetabolizing the things that we move from the tissues.
I
So
think that
yes,
And it's at
inflammation
a
has
safe
become like
level.
a bad word.
yeah,
It
it,
is
has
Or
been.
chronic
It has
inflammation,
become.
but we know that
This is an
It's
acute.
not
It's
that
because you add itis to anything and it becomes an ICD-9
So,
code.
but to answer those in the health professions or health and fitness industry who says, how can you break things down and then make them better?
I mean, in the health and fitness, that should be standard knowledge.
Everybody's doing
If
it.
everybody read their
You
textbooks.
should know
Everybody's doing it.
You should know the healing process, and people are like, you shouldn't stimulate inflammation and bruising. It is a very common like therapy technique to do. It's what massage is doing. I mean, your massage is doing light inflammation. When you massage someone's skin and it becomes red, what do you think it is? It's blood flow. I mean, it's a light acute inflammation.
So we're encouraging you guys to,
Okay.
exercise and do whatever you're comfortable with, but know that we're aware of the fear that comes with some of it, but it also comes in, it's been around for a long, long time in all kinds of health and fitness modalities
and
to
plenty
cause
of
inflammation.
research
Yeah.
to support this. Yeah. If it was a isolated study in Germany that we had looked at, we would be like, yay, this is cool. But this is very common knowledge.
But we're doing our own studies and we'll keep going, and we'll keep looking at it.
Mm-hmm. So I knew this question was going to come up. Everybody now is talking about creating the program for let me try that again. Creating the program for professional blasters. I want that to be something somebody has to say 10 times in a row.
Program for professional
So
blasters.
Tanya Brown, as well as the other ones who are asking. I'm glad you're asking, because this is most definitely, just so you guys know, we are not just randomly doing research. This is things that we sit down as a team and a company and really strategize what we're going to look at and when we're going to release certain information and when we're going to introduce the professional blasting and even beyond that. So we are avidly and quickly working on all of that. I would say within the next year and a half that you're going to see some courses coming out. We're going to see some certifications, and we're certainly moving in the direction of having this become a new field, or new industry in the healthcare industry. So be patient. I can give you a little teaser that at our Dallas location, it's not going to be a Con Ed type situation, but we are going to be going a little further if you do it professionally, where you can learn some new techniques. So we're going to be adding that to the Dallas stop. So yes, we're into it. I hear them all going, amen. I hear you, amen. We'll get a professional blasting program. It's coming. You have to understand that we are keeping up with the pace just like you guys are. And to be honest with you, I'm very happy that we have this. I mean, this was a big study, and I feel much more comfortable about everything that came out of it. In order to provide the most effective CEUs
So
for
someone
all the
who jumped
professionals.
on at the very, very beginning said, is the evidence-based research? Let me tell you why setting up our professional trainings is taking so long. We could jump on it and start doing it, and people are doing it and teaching people to do it, but we really want to have evidence-based and safe practices. We want to present
Absolutely.
best practice, safe practice, and evidence-based practice to teach you to do this, because our first studies were on normal individuals, which always occurs before you then do research on diseased individuals
Yep.
or injured people or abnormal individuals. So these are the baby steps that just happen first. We can't begin by saying we're going to do a study on fascia blasting and plantar fasciitis until we do fascia blasting on normal individuals. So this had to happen first, and then of course, as we know, it's safe and effective. We know what happens in the blood. We're moving next to skeletal muscles and looking at some of the other things that are going to come in the future. Maybe you're going to talk about that in a minute.
Mm-hmm.
But our professional training is not just what we think you should do, but we're going to tell you why you want to do it this way and what to look for. And since we're focusing on licensed practitioners, we know that you will be in a position to evaluate and treat conditions, and the FasciaBlaster would be one of your treatment
And just
tools.
be empowered versus just spoon feeding. I am definitely not give you the fish. I can't stand when we give a quick answer. Like, if you understand and you read this thing,
There's so much information in there, guys.
and you read the study and you really jump in and you engage in the group, you're going to be able to answer your own questions. And we're just going to be there to validate them and maybe give you a little tip over that. So,
And I think that you, Rachel's right. She says you need to have the scientific facts to qualify for CEUs. So what we're doing currently, which again,
Rachel.
thanks, Rachel, takes a long time, is we want to be approved providers of continuing education among all those license holders, not just in Texas or Alabama
Yeah.
or whatever, but nationally.
And not just LMTs. We want to be able to cross over for our chiropractors, or, we even have MDs including this in their practice. We even have
Can I-
psychiatrists. I mean, I'm happy. You go ahead. Yeah.
So can I tell them?
It's not a secret.
We're
Go ahead.
currently, we are currently approved providers on a national level to train fascia blasting and our fasciology to LMTs. and estheticians with their FasciaBlaster techniques. We're working
Oh,
on...
Lord, you're going to stir them up.
Yeah,
Here they come.
I know, but you have to wait on the curriculum because,
That's
yeah.
right.
So I know the massage therapists are dying for it, the estheticians and the face, and we're working on designing our face study, which will come out before we release those trainings. So again, it's just a huge process. We want to teach you, and we want to teach you correctly, and we want to be able to say, this is solid.
So I'm just kind of looking at the questions, and several people have asked about aspirin and blood thinner. So Bart, I'll let you take that away. By the way, Miss Leanne Klein, I'm gonna call you out on the page. This is something we talk about all the time. It's in the book. It's also in our frequently asked questions. It's in our pin post. But because we love you, we are gonna answer the question for you. Go ahead, Bart.
Okay.
About all, go ahead and just go into the whole blood thinner.
Okay. First of all, discuss with your doctor all medications. I mean, we're not here to really tell you over the counter or medications. That's all you need to discuss that with your doctor. But in general, there are a lot of blood thinners out there. You might be taking one and not even know it. You can blast on a blood thinner. It is okay. You can't blast on an anticoagulant or an antiplatelet drug.
What's a couple of examples of blood thinners that we might be taking over the counter that most people use?
Aspirin, ibuprofen,
Yeah.
naproxen. Very, very common blood thinners. The only thing that really you ever have to really worry about is like if you got into like a car accident and like your major bleed, like major like arterial bleeding.
Can I be clear? They're not even designed as blood thinners. They have blood thinning effects. So we take them for all kinds of things like pain, inflammation.
And let me jump in. It's just kind of like the overriding thing. We don't even know that it is bad to be on blood thinners, but because we haven't studied someone on blood thinners versus someone who's not. These are all theories. So we give you every single precaution to empower you based on what we think.
So exactly. So an example of an anticoagulant is warfarin. So like usually this is a prescription drug prescribed when you have a blood clot or you're having blood clotting issues or maybe post-surgery. Anything like that is when you would get prescribed warfarin or
Coumadin,
Coumadin.
heparin,
Those are all
warfarin.
and they're usually for
After stroke.
an after-stroke patient or an after
Somebody just brought up tight spastic muscles due to brain injury. Of course. Any tight spastic muscles, you can use it.
on tight spastic muscles, but I mean, ultimately, a brain injury, we might not be able to. Obviously, there's a lot of issues going on there, but symptoms, yes.
It's not going to cure the brain injury, but definitely Kathleen and I both have used it on traumatic brain injury. So really quick, I just wanted to jump back in for some of you who may not have joined us. Just remember, these live feeds, they're recorded. You can go find them. Oh, look, Bart, you're adorable. Why is Bart adorable?
He's so
And just for the record, he's not my husband. He's 15 years younger than me. Ew. I have recruited him pretty much since high school.
Yeah. I met you when I was 17
They're like, I thought Bart was Ashley's husband. That's so funny. Bart's not my husband.
Friend of a friend. Just
but
lucky.
just love you like a kid.
I know.
Okay.
My second
so
family.
this is what we have know so far in the research. We kind of bounced around and talked a little bit about all of it, but I'm going to give it to you in the summary. This is where you can find it at ashleyblackguru.com/findings because it is the findings of the study. Okay, so number one, what we know is that when the FasciaBlaster is used as directed, it is safe. Boom shakalaka laka, boom shakalaka. The FasciaBlaster smooths out fascia. And to me, what was amazing, and honestly, I didn't know how deep it would go, is that it smooths it not only at the surface or in the first few layers, but literally all the way down to the bone,
And what
visibly.
about even intermuscularly?
Yes.
Changes. Intermuscular
The one
changes.
that's crazy,
Yeah.
if you go to, I think it's right here. Look at, this isn't the one.
Day 90.
Never mind. The 90-day result, literally the fascia looks like this in the first one, and it is laying within the muscle so beautifully and so smooth all the way down to the bone, which for somebody like me who uses it for chronic pain, I could be diagnosed with everything, by the way. I'm sure I could go get a Hashimoto's, for sure a fibromyalgia, because when you are as injured and wounded as I am, no matter how hard I work on it, if I don't address my fascia, it will recoil and I'll have those full body inflammation. It shows in my blood too. I still have a white count. I can get a rheumatoid arthritis diagnosis. You want to go get that? That'd be fun. Okay, so now I lost my place. All right, so it smooths out fascia all the way down to the bone. Number 3, this is the one that we're just so you know, we are compelling the FDA to let us use the word cure. We're waiting. It's about a year process, but I think we're going to get it. But right now we can say the FasciaBlaster is effective for treating cellulite, which if you guys saw this,
the FDA said we can say that.
We can say that the FasciaBlaster is effective in treating cellulite. So
Add
all
it
the
to the
challenges,
wiki.
we got it.
Yeah, I'm super happy about that. And I have to tell you that, you know, along with these ultrasound images, we have the corresponding photographs. They're coming to me. They're so high res that they're coming to me on a little hard drive in the mail. But I'm going to start leaking that. And you guys won't believe it. I mean, we did not pick ladies who were really close to what I would consider, you know, goal. And over the 90-day period, the impact on cellulite is way more dramatic than any other procedure I've ever seen. Just boom. The FasciaBlaster releases fat into the blood, which we discussed earlier, which means that it is burning fat and that it is able to be metabolized. The levels of fat in the blood were safe and consistent with diet and exercise, which is awesome, which means that we're having the same effect not only with burning the fat, but the metabolic rate that goes along with it, and that it can be expelled from the body at the right kind of timing.
Safely, naturally.
Safely and naturally.
Yes.
Love it. Because, you know, we do have people ask that, like, you know how they tell you in liposuction, if you suck out one area that it's going to create fat cells, and that will not happen with the FasciaBlaster. The FasciaBlaster improves muscle performance, which we didn't really get into. But what we do see in the ultrasound images, and Bart, you can speak on this one, I love this, is that I just put in the blog better muscles for the layperson, but we're seeing more density in the muscles. So explain to them when the muscle is more dense, what effect does that have not only on the look, because the look is obviously striations and, you know, harder, more toned muscles, but on performance.
We didn't tell them. We also had them do quad sets after blasting, so that was a
isometric quads and hams.
So
not the first 30 days. I remember we added that.
No, so we progressed them into it. So we really took them slowly through. We planned it out over the course of the 12 weeks. We took them forward and back based on what we thought they needed. That's why we kept visiting them. So we had them activate, and over the course of the 90 days, their fat was decreasing, and just through simple activation techniques, they were getting hypertrophy of the muscle tissue.
And just so y'all know, hypertrophy just means that the muscle
is growing.
Is growing. Okay,
yeah, it's growing. So the lean. Everyone likes lean muscle tissue. You're literally creating lean muscle mass.
So when you say they're activating the muscles after fascia blasting,
there's a little
did
confusion.
they have to do a weight machine to extend and flex their legs? Did they have to use? Did they have to do a machine, or what do you mean activating?
We just had them do an isometric contraction against. They were dragging their heel against the floor, and then just doing a contraction of their quad. We had
and just so y'all know, this has been posted in the comments. I saw one of our staff or one of our moderators. There's a post within the comment thread. You guys can go right in there and go to that link where we teach you how to activate.
How to do the quad. So that exact video is what we would have used for them, and it was very simple. We didn't have them do any more exercises other than that.
And for those exercise nuts, you're going to go, an isometric quad set, that's not going to do anything. Wrong, it is. And you're going to need it. We're teaching isometric quad sets, ham sets, and isometric abs for your wall test. So if you're working on everything we're teaching, doing your wall test and your posture. I saw a great video, wish I knew who posted it, where the girl showed herself doing her pelvic tuck that she does in standing from her wall test, and how she's working on contracting her abs to reduce her
Can
sway
somebody
back.
post the wall test, please?
It's fabulous.
Or the playlist.
So
for
these
the
are
wall
all isometric holding, which has to happen to get the strength before you can do coordinated movement.
Well, and I also think that there's I was explaining it yesterday. I hope Allison Rattay might be on here. She can chime in, but most of you would just want to punch her in the face because her body's so great. But I've been coaching her for over the past 2 years. She's one of the original blasters, and she's a fitness model. So she's not looking to look good or better. She's looking to look perfect, which, by the way, is a lot harder. And she's 39 years old. So then there's other factors that play in a mother and all of that kind of stuff. But she kept texting me, like I'm worse before better for 6 months. And I'm like, that's not possible. And so Bart and I worked with her, and I'll post the video. I have it in my phone. I'll post it in the comments when the feed ends. But what happens is when you're trained to do a hamstring curl, that doesn't mean that you're firing your hamstring. You could be doing that with your back or your glutes. If you're doing,
Did you slay her on her exercise?
I slayed. It was awesome. It was so great. I've got a great recording of it. And it was awesome for her because, she didn't take it, she took it as like, oh my God, I have a new like weapon in my arsenal, and it all made sense. And she's like, wow, so I need to go back to like the old school bodybuilding. And I was like, yes, like you need to isolate one muscle at a time, because what you said earlier, and I wanted to go back to it, is when people talk about loose skin, there is no science to support that the skin is loose. We're increasing blood flow, which is going to tighten skin. So even though it may look like loose skin, it's not. The skin is tightening. What you're seeing is that those muscles underneath aren't now bound up with the fascia and the skin, and they need to be activated and grown. And so before you even ask, I'm going to answer the question, because people always say, well, I don't want to get bulky. Well, if you are a female and you are not taking steroids, you are not going to get bulky.
Your hormone levels.
Do you know how difficult it is to actually get bulky? I think what people are even calling bulky may be when you do heavy lifting, you get bound. So I think some of that, what people think of as bulky, but I can assure you, if you are doing muscle activation, isolative, isometric exercises to fill up your skin, you are not going to become bulky. Yeah. It is very hard. Take it from an ex-bodybuilder. It's very hard to bulk up.
Good job.
It's hormones is what cause you to bulk up like that. So well said.
Well, I mean, I just say it honestly.
Yeah.
As long as you're not injecting yourself with something, you're not going to grow that big, ladies.
Well said.
So the other, I love the term chirping. That one of my baseball players used to say it. He was chirping in my ear. So the people chirping right now are the over 50s.
Yeah, I saw that.
Okay, so let's talk a little bit about where we can bridge. Just because we didn't do formal research doesn't mean that this doesn't affect someone over 50. So talk about well, you're over 52. My birthday's next week.
Also, you mean not over 52, over 50 also.
Also not over 50.
I'm a little bit over 50.
Look how good you look, girl. Shit,
I think so.
I'll be shouting it from the rooftops. I can't wait till I'm 50. I'll be like, that's right, 50 and fabulous. But I do want to talk about what changes as we age in general. And I mean, to me, my mother's in her 70s. She's using it, and I realized that
I might not be a good. Okay, the biggest things that have changed for me, my vision to read.
Yeah, me too. Starts at 40.
And certain things, but I'd say not a lot. I mean, I still have regular menstrual periods. So I know that some women over 50 have began menstruating again. So it's kind of doing some things with sloughing their uterus and kicking things up again. That is worth studying. I think we
totally
don't know
agree.
much about that. But I think that for the muscles in general, for the subcutaneous fat, for the blood work that's happening, there's no difference in being over 50 and being under 50 in terms of our study. I have to have reading
I love that.
glasses and
I totally agree with you. I was hoping you were going to say it. I was looking at you like, say it.
I don't think
You're
there's
allowed
any
to exercise
difference.
past 50. You
can
FasciaBlast past 50.
Can do anything I want to
so
do.
You brought up
Getting
something
better,
I wanted
better,
to go back to is we had this wonderful conversation, and if you are reading along in the blog, probably you read it an hour ago, but if you're reading along in the blog, which is ashleyblackkguru.com/findings, we talk about, okay, those are the things that we know, and then there's things that we don't know. And Kathleen brought a very fantastic theory to the table, and I want to talk about biofilms.
Yeah.
This is, I really think when it's all said and done, we're just going to high five and go, that was it. But explain a little bit about biofilms and why we have this theory. This goes into everybody's asking about detox and all that kind of stuff. This goes in the category of things that are changing that wasn't explained in the blood. Because, when we got the blood back and we didn't see an increase in estrogen and we didn't see lactic acid and we didn't see these huge hormonal chains, I was like, but my boobs do get warm when I blast, and I do sometimes feel exhausted. So
it's really
this goes in
important.
the category of things that happen when you blast.
So understand that when we say there's no evidence in the blood to say that things are going awry, it doesn't mean that we're not acknowledging the fact that people are having side effects, right?
Sure.
They're having side effects or symptoms or experiences with blasting that vary as many as there are different people on the page. There are different kinds of symptoms. So as we were looking at, well, it's not the blood, it's not the hormones, what is it? I just came upon the teaching about biofilms. Now, what that means is that in between layers of fascia and in between layers of tissue in our body,
particularly structural fascia. That's what I found so interesting when I went diving down that hole after you came over.
Did. Good.
And I went and looked at the images, and I was like, wow, the most of the biofilms or slime,
Yes.
the things were within the fascial sheets of what in my book I describe as the structural fascia.
It's because of the way they like to grow. So these are biofilm layers of microbes. Okay, can they be bacteria, virus? They're tiny things that are living within us, and it's not a new thing for us to know that things live inside of us, inside of our gut, but also then now in between our tissues. And so the way they like to grow is in these expansive layers, even single cellular layers of film, and they grow between our structural fascia layers. So you had said it, I think we did a live feed a couple weeks ago when you were talking about these layers. So if you've ever had meat in your refrigerator and then you touch it after a few days, it gets slimy on top and slippery.
Such a great visual.
And it is, and you know what? If you hold it up to the light, it also kind of glows a little bit. So it has some little photofluorescence on it. But there's, research to support the fact that there are these layers, single layer, cellular layers of things that live within our fascia that I think, and between the layers, that we are perhaps shaken up a little bit. And I'm not afraid to say that that's happening. I don't think anyone's talked about what's happening there. But this could explain the activation of dormant viruses or infections in our body, that those infections are bacteria and viruses have remained dormant in our bodies for a long time.
Well, and I just go back, I'm just so drawn to our ultrasound image. Like, look at this baseline one where all the fascia is just mangled. So if this has slime in the meat and you release it, I mean, I think that explains all of the detox. To what extent, I don't know, but I mean, I certainly can make a case for it.
So I agree.
I can tell you that personally, I have had, it wasn't even a FasciaBlaster treatment, but I had an intense, my neck was so tight, it spazzed on a airline and literally locked, where I couldn't turn my head, I had lockjaw and everything. And when I had all that stuff released, I had a 24-hour flu.
Okay.
Like, no kidding.
So those
Or
things,
you have somebody like my mom who had raging shingles, FasciaBlast, nothing. So I think the question is what does release, what doesn't, and that we have to, first of all, just have we have no idea, but we want to give emphasis that we believe your symptoms and we believe that all this stuff is possible. And I also don't believe that we have all of these answers.
We don't. So
and I don't think anybody does.
You have to decide, do you want to go through the potential ridding your body of whatever might be living inside of it? And I'd raise my hand and say, well, I'd like to, because that means if I did a full fascia blasting session, which I've done, and I did have flu-like symptoms when I first started, that I'd like to restore my health between my tissues, increase blood flow, hydrate so that it's water in between my layers rather than some kind of slime. I mean, that's just creepy to me. So I think if you understand that you're in a body remodeling project.
Love that word, bodily no more worse before better. We're in a body remodeling.
That's what that's called.
You're going to remodel your house. You're going to make a mess. You're going to find the trash that you hadn't seen and the dust that you hadn't seen, and you have to take it out. We're remodeling our body like we'd be remodeling our kitchen. And you're going to find all kinds of crud that you didn't even know, that you'd picked up along the way just because you'd been living in your kitchen.
Pam Letourneau, who, by the way, answers every single question on our page, and she's also our friend. We can't wait to see you, Pam.
And nurse.
But she is a nurse, and she basically just said it all depends on your individual physiology.
It does.
And I make a point in the book to say that these fascia cells are just like any other cell in the body. So I saw a comment earlier about somebody saying, well, if I'm over 50, certainly my thyroid, my this. Absolutely. Every single factor, whether it's age, disease, condition of the tissue, whether you were a smoker, whatever you did when you were a kid, these fascia is cells like any other cells, and they're going to be affected in a similar way. All we're saying is that, we have ways to clean out the blood and we have ways to work muscles, but we're specifically talking about restoring the fascia. So we know this in other industries is what I'm saying, as far as like the clean out or like the effects of all the other stuff. But biofilms are in the fascia.
Yes, they are.
Yeah.
So stay tuned. There's going to be more coming out about that for sure. That's an interesting and good conversation to have.
Leanne Klein says she'll be glad when the remodel is done. That's okay. We're in the reno phase. It's all good.
Or demo.
Yeah, we're in the
Glad
demo.
when the remodel
Yeah,
is
it's a
done.
demolition phase.
I can tell you that the first time I remember on my bad leg, when I say bad leg, I just mean my hip replacement side. I think it compensated so long. And we used to dig through it with our fingers. It was just huge knots. And I remember the first time that I really got FasciaBlasted, I stood up and like all the skin pretty much just fell down because I had no tone whatsoever in the muscles. And so it's a process. And I think that the process is actually exciting. And I think that the same way we get excited when we get a bruise, you know, we should be excited when we see any type of change, whether it's visually appealing at the time or not. So we're going to wrap up the show. First of all, I hope you guys enjoyed this. We always have these amazing conversations in private, and we're like, we have got to get on the page and give these women what they want. But I just thought I would wrap it up with just kind of your thought for the day about this research, what you're most excited about, and then
I'm most excited about certain things we haven't even got the measures back in the blood. Like there's a certain collagen marker that'll prove like remodeling and stuff. So I'm like, there's all these hormones and markers I'm waiting to come back for. So I'm real excited about that.
And when can we actually expect that? We don't.
We're end of April.
Yeah, we're hoping like the end of April.
that's
I mean,
soon.
and then so yeah, it's just know that it takes a lot of time, guys. Like we've done this way faster than most stuff gets done, just like anything else in this company. But
Yeah, we
we're
do.
excited.
We're like
just,
Facebook speed
We're
here.
excited. We're trying to get it done. I mean,
Tell them
we
about
hear
the
you.
men's study.
The men's study, we're once we get the subjects done, it's probably in about a month and a half, and it's pretty much we're going to be fascia blasting 20 men, and we're just going to be doing their legs, and we're going to be analyzing them biomechanically, pretty much like if their skin wasn't there, like what is exactly happening in the muscle. It's a lot more muscle physiology related, less on like fat metabolism. There's not going to be blood work or anything, just a lot of like muscle activity markers and just some great stuff to help prove that it can improve muscle performance. It's very exciting. That's what she brought.
And I want to measure the testosterone.
Yes. We will.
I want to know what's happening with men with the fascia blasting.
But you've talked about rate of neural firing,
No doubt.
muscle firing, motor unit recruitment, all those kinds of things will show with
Well,
this one,
it's
so
funny
nice.
because all of a sudden I ended up in the beauty business when I never ever did any of this. If you guys don't know my history, I worked with pro athletes and kind of your population, like the hopeless, for almost 20 years. So going into
Do
like
I specialize
cellulite-
in the hopeless?
Yes, you do. Listen, I'm the last stop to Pittsburgh, and you might be further down the track. No, Kathleen and I do have an interesting background with that population. People used to call me the last stop to Pittsburgh because I would get the ones where they'd been, kicked to the curb by everyone else, and if I couldn't figure it out, I usually send them to you.
But what I like about you're talking about the skeletal muscle studies, we're looking not only at what's happening to the muscle, we're talking about motor units, how much it fires, how fast it fires, how efficiently the muscle works. But this gives us a hint into the nervous system because we're using EMG to look at what happens even to the peripheral nerves.
Yep.
And so this is our first stop into kind of that too, and looking at
Kind of connects everything together as well. We learned a lot from the women's study that we don't need to do that with the men because it's already you learn off of all the studies we do. Like we get so much information. It's exciting.
It's very exciting.
What are you most excited about?
Well, gosh. In the future,
So many things.
There are so many things. I mean, I'm excited about the way the wheel continues to roll. The way that the team grows, the team is building as your leadership allows. We're starting to answer important questions, not impulsively. We're starting to roll things out thoughtfully. I know that the customers want it faster, more, and whatever.
Yes.
But I like that the way it's happening because it's forever. It's to make the biggest impact in the best way. Moving towards evidence-based trainings and teachings, doing our research. I mean, I just can't say enough about just how it's working. I'm excited about everything, every aspect of it. All the new products.
Well, I
the
have to
face,
tell
the
you,
research.
I am most excited right now because, while all this research going on, for me, I'm the one that has to go on television and get, you know, or blogs or, you know, whatever haterade is thrown at me. And I love having the validation because I can literally sit there and just say, it really doesn't matter what your opinion is or what my opinion is. Here's the ultrasound. Facts are facts.
Blood
it doesn't
number,
matter if one person
numbers.
believes it or not, right?
Yeah.
Well, and I hang on to something. When you look at any scientific movement or any innovation, and we are certainly innovators here, not only are those who are living with old facts going to say that we are going against what they consider facts, we are messing up the things, we are turning tables over, and we are changing the world this way, like, whoa! But so there's a reaction and pushback from that. But I also have to say that as we learn, people have to give us permission to shift gears also.
Absolutely.
So we are talking about new science and new things, and we're not trying to, we appreciate and respect the work that everyone who's come before us is doing.
100,000%.
It has laid the groundwork for what we're able to find. So
No doubt
every
about it.
Hater or doubter, it's okay. Come on, join and study with us, and then we may even correct and adapt on some of the things we've said.
I can tell you that we are constantly, like literally every single week, in terms of our responses of what we say on social media. This book has a second volume with, by the way, #1 national bestseller on the top, but it also has a lot of revisions because the research has come out since we wrote this. So I think that's huge. We do need permission to say, you know what, we thought that and we were wrong.
Yeah.
Or we thought that and we were right. In fact, we were extra right. And in fact, we were a little right on this. That's the way that this works. So
maybe that's what I'm most excited about. But the opportunity to develop the culture of the kind of company this is and the kind of attitude we have.
Yep.
Which is one of just
why
keep
not?
pressing
Let's do
ahead.
it. Yeah. Yeah, we're very happy with the research. And I saw a lot of, you know, it's jumping up. It's kind of hard to read everything, but there were several international people. I saw a bunch of Canadian flags going on. I'm going to ask Steve, who's just off site. I mean, we are so close to international distribution right now. Canada, Europe, and Australia. By the end of the summer, is that safe to say?
Late summer.
Okay, late summer. Unless things, hey, like I said, we might come out and go, we were wrong. But we are working on it. I don't know how much you guys know about supply chain and distribution. I can tell you that was never a business that I was in. And there's a lot of learning curves. There's a lot of different tariffs. I see Sylvan says, I want to be the Spanish translator. Oh,
Yes,
Savannah, we
ma'am.
have a huge competition for the Spanish market. Most of our social media team is fluent in Spanish, but I would love to go to Latin America. But right now, our focus is on Canada, Australia, and Europe because those are just the easiest places to send crates, have our software talk to their software, and for the laws and the FDA and all of that. So it's a big process, but we are doing it. We will be global by 2020. In every single little nook and cranny of the world. I'm going to be down in Costa Rica next week, and that was not one of the countries that we patented in or did anything because it's just such a little country, and the people that I normally deal with to get set up with, you know, houses or massages or whatever, they already reached out and was like, can you please bring a big box down here? They have like a $200 tax. So anybody who is in a foreign country, that I see Portuguese, anybody who's in a foreign country who is having to deal with the country regulated tariffs, we are sorry, we don't want you to have to pay that. Of course, we want you just to have the normal fee, and so we're working on that for you. But it's a process, and give us a minute, but we're working on it. So I'm going to go ahead and wrap up the show. I know you guys probably loved hearing the information. We're going to try to do it more often. We're working towards having one of us do it weekly, and whenever we're together, of course, trying to do it then. I think that the more we press forward with putting the information out there, it's just going to speed the movement up. And I just want to thank each and every one of you. I've been reading the comments, and I see several of the people from the study in there. I just want to tell you how much I appreciate you. And I hope that try, if you can, to come to a book tour stop. It'll really be life-changing. Each stop is life-changing for me. I meet somebody who touches me, and multiple people that touch me in every place that we go, and you'll meet other people that will touch your life. And even if you have to travel from, I don't know, Kentucky to come to Atlanta, if it's in your budget or if it's pushing your budget, try to do it. The events are free, but we want to see you, and we want you to be a part of those live events. And if not, we'll see you right back here on Fascia Nation.
Fascia Nation.
Thanks,
We need
guys.
a lingo.
Thanks, everybody. Yep.